Hello, I'm Dr. Goh Xueying, and this video is about hearing loss in adults. Why does it happen, and can it be corrected? Hearing loss is extremely common. It affects 3% of Singaporeans, and that figure rises to over 16% if you're over 60. There are three types of hearing loss: conductive, sensory neural, and mixed, and causes of these vary. What doctors call conductive hearing loss refers to a problem with a sound reaching the inner ear, and this could be caused by physical obstruction, like a buildup of wax or foreign body in the ear. Conductive hearing loss could also occur due to an external ear infection, fluids in the middle ear, eardrum perforations, or problems which affect the small bones of hearing in your middle ear. Hearing loss could also be sensory neural, which means the sound reaches the inner ear but is not converted to nerve signals that are passed into the brain. Sensory neural hearing loss can be age-related, noise-induced, or a side effect of medication, and that can occur suddenly, and you will need to see a doctor immediately. Although it's rare, sensory neural hearing loss may also occur due to tumors in the brain. It is important for your doctor to understand if the loss is sudden or gradual and it affects one or both ears. Your doctor will also ask about symptoms. Is there pain or discharge? Do you feel dizzy or hear a ringing sound? You will also be asked about other risk factors such as family history, occupational or recreational noise exposure, and if you had any medical problems or any procedures that may lead to hearing loss. To evaluate the cause of your hearing loss, your ENT specialist will examine your external or middle ear using an otoscope or an otological microscope. In most cases, the cause of hearing loss is due to impacted earwax or a foreign body, which the doctor will clear, thus resolving the problem. Your doctor may also want to do a hearing test using a tuning fork or audiometry to evaluate your hearing. Audiometry is done in a soundproof booth and reveals how well you hear at different frequencies. As part of audiometry, tympanometry, which is a test of eardrum function, is usually done. And this involves placing a probe into your ears, which will apply some soft pressure to the ears to test the eardrum movement. For audiometry, you will put on a pair of earphones and a bone oscillator will be placed behind your ear. The audio technician will play a tone at a specified frequency and volume, and you'll be instructed to press a button if you hear it. And this will be repeated multiple times over a range of frequencies and volumes. This test will determine the lowest volume you can hear at different frequencies, which is represented in an audiogram. The result will reveal if your hearing loss is conductive, sensory neural, or both. Most patients do not need further investigations after a hearing test. Sometimes the doctor may want to investigate the cause of hearing loss, especially for patients who require surgery or have unexplained hearing loss on one side. Depending on the type of hearing loss, the ENT doctor might advise on a CT scan or an MRI. In general, the CT scan of the ear bone is used to investigate conductive hearing loss, and an MRI may be done for sensory neural hearing loss. The treatment of hearing loss depends on its underlying cause. For hearing loss caused by external ear infections or earwax impaction, it can be treated with oral clearance in the clinic. Eardrum perforations or ossicular bone problems can be treated with surgery. Patients with sudden sensory neural hearing loss need to be treated urgently with steroid medications and require close follow-up. However, some types of hearing loss, especially sensory neural hearing loss, cannot be reversed and will require hearing aids or hearing devices for rehabilitation. Hearing aids are fitted by an audiologist and are customized to the patient's hearing configurations and needs. For a small group of patients, even hearing aids may not work well enough. Hence, they may opt for hearing implants if eligible. One type of hearing implant is a cochlear implant. It is an electronic bionic ear implant that is implanted to the inner ear to help rehabilitate sensory neural hearing loss. For severe conductive hearing loss, bone conduction implants, another type of hearing implant, serves as a form of rehabilitation. Family history and existing medical conditions like diabetes, cardiovascular problems, as well as previous exposure to certain medications could put you at risk of hearing loss. In addition, constant exposure to high volumes of sound, either from work or recreation, will increase your risk of hearing loss. Age-related hearing loss is the most common cause of hearing loss in adults, and it occurs really slowly. By the time you notice it, it's probably significant. We usually recommend hearing aids if the hearing loss affects your daily activities. For example, having to ask your loved ones or friends to repeat what was said and having difficulty in following conversations. Hearing aids can reduce the amount of effort needed and stress on your brain when listening, freeing up the precious brain processing power for other activities like memory. Studies have shown that hearing aids may slow down the development of dementia in elderly patients by allowing them to remain socially active and engaged in daily activities. If you suspect that you or your loved ones have hearing loss, please consult an ENT doctor for further assessment and early intervention. Thank you for watching.